And so we're at least starting to see some people in the allopathic world recognize that, hey, there's multiple things here, and we sometimes need to treat multiple things, and we actually need to start treating pain generators and not just, oh, your imaging just shows disc collapse. Okay, let's just treat that.
Does it come down to insurance not paying a lot of the times for the treatment of more than one thing?
I think potentially, I think that's definitely going to be something that needs to shift. Once insurance starts to come in and cover, everybody thinks that's just going to be this magical thing when PRP finally gets covered for knee osteoarthritis, because that's probably going to be the first thing that it gets covered for. Yeah. People think it's going to mean that they can come in and get the type of treatments that we do, which treats the fat pad, treats the nerves, no, they're going to pay for the joint code and the PRP code, and that's it. Yeah. And so, if we ever decide to take insurance, it would either be, hey, insurance is going to cover this portion, you're responsible for this other portion because we need to do all the other things, or what other places do is they lump it all into the joint code and say, okay, well, I know I'm only going to get paid $800 to do this injection of PRP into the joint, and I'll just eat the cost and I'll treat the other stuff because I care about the patient getting better. Right. And just we don't bill insurance on that. Or just not work with insurance, and then again explain to potential patients why is, well, they're only going to pay for this one thing. Yeah. And that's all they're going to pay for, and we need to do all of these other things in order for you to actually get better. So that's a bridge we'll have to cross when we get there. But I think that's going to be the biggest problem. One, to getting it covered in the first place. Yeah. And two, then actually getting patients better when we start doing that.